Magandang araw sa inyong lahat. Sa bidyong ito, tatalakayin natin ang nervous system at kung ano ang mga diseases nito at paano ito mapiprevent. So let's start. Ano nga ba ang nervous system? The nervous system is the major controlling, regulatory, and communicating system in the body. It is the center of mental activity, including thought, learning, and memory. Together with the endocrine system, the nervous system is responsible for regulating and maintaining homeostasis. So guys, simulan na natin ang 5 diseases ng nervous system. Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is the most common type of irreversible dementia. Gradual loss of memory, intellect, rational thought, and social skills. Nearly 7 out of 10 people with dementia have the Alzheimer type. There are 2 main types of Alzheimer's disease. Sporadic Alzheimer is the most common form and usually occurs after age 65. Its cause is not fully understood. Familial Alzheimer, sometimes referred as hereditary, is caused by a very rare genetic conditions and results in dementia, usually in people in their 40s and 50s. This is known as younger onset dementia. What are the symptoms of Alzheimer's disease? Early on, Alzheimer's disease may be hard to notice. The first signs are usually memory loss and difficulty finding right words for everything. However, many people have trouble with memory but don't have Alzheimer's. So it's important to visit a doctor to work out the exact cause of memory problems. Other common symptoms Other common symptoms of Alzheimer's disease include vagueness in daily conversation, lack of enthusiasm for activities you once enjoyed, taking longer to do regular tasks, forgetting well-known people or phrases, difficulty processing questions and instructions, a decline in social skills, unpredictable emotions. Alzheimer's disease is sometimes classified into 3 stages based on the severity of symptoms. Mild Alzheimer's disease, early signs of dementia, no additional support is usually needed. Moderate Alzheimer's disease symptoms are difficult to cope with, the support is likely to be required. Advanced Alzheimer's disease, continuous care in all daily activities may be needed. What causes Alzheimer's disease? Several processes occur in Alzheimer's disease, including amyloid plaque deposits, neurofibrillary tangles, and neuronal death. Amyloid plaques are deposits outside the brain cell. They prevent the brain from passing signals properly. Neurofibrillary tangles are deposits inside the brain cells. They kill the cells by blocking of food and energy, causing dementia that worsens over time. Neuronal death causes shrinking in the outer layer of the brain, the cortex, which is vital to memory, language, and judgment. Alzheimer's disease is characterized by this shrinkage. How is Alzheimer's disease treated? Although there is no cure, certain treatment may improve symptoms for a time. Many people with Alzheimer's disease also learn ways to cope with their symptoms and improve their quality of life. Medication. A group of medicine called cholinergic drugs may temporarily improve cognitive symptoms of mild to moderate Alzheimer's disease. This work by increasing the level of a brain chemical called acetylcholine, which help to restore communication between brain cells. Lifestyle changes. Where possible, a person with Alzheimer's disease should try to maintain normal social contact with friends and family, exercise regularly, and engage in activities that stimulate the brain. If you have any concerns about safety, for example, driving skills, see your doctor for advice. Glenn Campbell had Alzheimer's disease. Next is the Bell palsy. What is the Bell palsy? Bell palsy is a sudden weakness of paralysis is one side of the face. It is caused by inflammation or damage to the facial nerve. It is usually temporary. Most people start to get better in 2 weeks and are fully recovered in 3 to 6 months. A few people don't recover fully and are left with some weakness or paralysis of the muscle in their face. What are the symptoms of Bell palsy? The main symptom is weakness or paralysis of one side of the face. It is usually at its the worst within 2 to 3 days after its appearance. Bell palsy can also cause a dropping eyelid or difficulty closing one eye, difficulty smiling and making facial expressions, drooping of one side of the mouth, difficulty eating and drinking, drooling, pain or sensitivity around the affected area, a headache, loss of taste, change in the amount of tears of saliva. If you develop these symptoms, see your doctor immediately or go to your nearest emergency department. What causes Bell palsy? A viral infection is thought to be the main cause of Bell palsy. The infection inflames or puts pressure on the nerve that controls the facial muscles. It can be mild or it can be severe. How is Bell palsy treated? To treat Bell palsy, a doctor may prescribe oral steroids or an antiviral medicine in the first few days of the onset of Bell palsy, as this can improve of the chance of a full recovery. They may also prescribe lubricating eye drops and an eye ointment to protect the affected eye, and they may recommend physiotherapy or face massage. How can I best recover from Bell palsy? You can help you recover by using prescription eye drops and ointment regularly, wearing glasses or goggles during the day, using an eye patch or taping your eye shut if recommended. If the pain is bothering you, place a warm, damp washcloth over your face several times a day and take over-the-counter pain medication. Angelina Hawley had Bell palsy. Third, what is cerebral palsy? Cerebral palsy is a condition that affects body movements due to brain injury. The injury can happen before, during, or after birth and does not get worse over time. The brain damage affects body movement and posture. It often shows up as either flabby or stiff muscles, or involuntary muscles movements. Cerebral palsy can affect movement, coordination, muscle tone, and posture. It can also be associated with impaired vision, hearing, speech, eating, and learning. The damage to the brain is permanent. There is no cure. Life expectancy is normal or near normal in mild cerebral palsy, but the effects of cerebral palsy can cause stress to the body and premature aging. What are the symptoms of cerebral palsy? Cerebral palsy causes a range of symptoms. The most common ones are being stiff or floppy, having exaggerated reflexes, muscle weakness, lack of muscle coordination, uncontrolled body movements, problems with balance and coordination, problems with swallowing, sucking or eating, using one side of the body to reach for things, delay in learning to speak. These symptoms can be mild or severe. They usually appear in a child's first 2 years of life. People with cerebral palsy may or may not have other conditions such as intellectual disability, epilepsy, delayed growth, spinal deformities, and troubles with seeing, hearing, and speaking. Can cerebral palsy be prevented? There is still no way to prevent cerebral palsy. However, making it law to wear seat belts and use pool fencing and giving rubella vaccinations have all brought the rate of cerebral palsy down in Australia. Sometimes babies who are at high risk of cerebral palsy may receive medications or be treated with cooling therapy to reduce the risk of or severity of the condition. Roy Frank, R.J. Mead had cerebral palsy. What is multiple sclerosis? Multiple sclerosis is a chronic disease that affects the central nervous system. It affects more than 25,000 people in Australia, and it is 3 times more common in women than in men. MS means there is damage to the protective sheath, known as myelin, that surrounds the nerve fibers in the brain and spinal cord. This damage causes scars or lesions in the nervous system, meaning that the nerves can send signals around the body properly. What are the symptoms of multiple sclerosis? MS usually starts with mild symptoms that may or may not get worse over time. Symptoms depend on which part of the central nervous system is affected and how much damage has occurred. The most common symptoms are problems with controlling the body, like muscles, spasms, weakness, loss of coordination and balance, tiredness and sensitivity to heat, a hot day or a hot bath, or even a hot cup of tea can make symptoms worse. Other nervous symptoms problems including vertigo, pins and needles, dizziness, neuralgia, and problems with eyesight. Continence problems including bladder incontinence and constipation. Charts in memory, in concentration, in reasoning, in emotions, or in a mood, such as depression. The symptoms of MS vary widely from a person to person. They can also come and go in any one person. MS is unpredictable. How is multiple sclerosis diagnosed? A range of tests can be used to diagnose MS, including an MRI to detect lesions in the central nervous system, a physical examination to check reflexes and responses, blood tests, lumbar punctures, and other types of tests to measure nerve activity. Sometimes it can take years to reach a diagnosis because there is no single test for MS. A person will be diagnosed with MS if there is evidence of lesions in different parts of the central nervous system at different times with no other explanation than MS. How is multiple sclerosis treated? Medicines can delay the progression of MS and reduce the risk of relapses. These are called disease-modifying therapies. Other medicines are used to control symptoms. The best medicine for you depends on the type of MS you have. Talk to your doctor or other health professionals who care for you about the right combination of treatments. For your situation, disease-modifying therapies work by targeting the immune system. They slow the They slow the frequency and severity of attacks, so the myelin sheaths are damaged less. These medicines are also called immunotherapies. However, these treatments do not reverse current symptoms and there can be significant side effects. These medicines are usually used for people with relapsing remitting MS. Steroids can reduce the severity of an MS attack by reducing inflammation and suppressing the immune system. Medicine to suppress the immune system, called immune suppressants, are sometimes used especially for people with progressive MS. Jack Osborne had multiple sclerosis. Fifth is the epilepsy. What is the epilepsy? Epilepsy is a long-term brain condition where a person has repeated seizures. It is thought to affect about 3 in every 100 Australians. Having just one seizure is not considered to be epilepsy. About half the people who have one seizure never have another seizure. Other conditions such as fever, diabetes, heart conditions, and alcohol withdrawal can also cause seizures. Epilepsy is not one single condition. Rather, it is a range of different conditions that can cause seizures. If you witness a seizure, you can go to Epilepsy Australia Seizures, First Aid and Resources. Seizures usually last 1 to 3 minutes. If someone has a seizure that lasts for more than 5 minutes, call an ambulance on 3. What are symptoms of epilepsy? The symptoms of epilepsy is seizures. These are episodes of disruptive electrical activity in the brain and can vary greatly depending on the part of the brain involved. Seizures can cause symptoms such as loss of consciousness, unusual jerking, movements, convulsions, as well as another unusual feelings, sensation, and behaviors. There are many different types of seizures. Generalized seizures involve the whole brain and therefore the whole body is affected. Focal seizures involve only part of the brain. Generalized tonic-clonic seizures, previously known as grand mal seizures. This type of seizures are the most well recognized. The seizures begins with a sudden loss of consciousness. The body then becomes stiff, followed by jerking of the muscle, turning red or blue, tongue beating, and loss of bladder control are common. Confusion, drowsiness, memory loss, headache, and agitation can occur on regaining consciousness. Generalized absence seizures, previously known as petit mal seizures. This type of seizures usually start in childhood but can occur in adults. These seizures are brief and involve staring, loss of expressions, unresponsiveness, and stopping activity. Sometimes eye blinking or upward eye movements are seen. The person usually recovers immediately and resumes their previous activity with no memory of the event. Focal seizures, previously known as partial seizures, start in one area of the brain and affect the parts of the body controlled by that area of the brain. The seizure may involve unusual movement, feelings, sensation, or behaviors. People can have different levels of consciousness during focal seizures. Febrile convulsions are common seizures occurring in about 3 in 100 healthy children up to the age of 6 years. The seizures are generally harmless and associated with an illness causing a fever, such as a viral infection. Management includes treating the seizure if necessary, as well as treating the underlying cause of the fever. In the absence of any risk factors of epilepsy, children with the convulsions have a similar risk of developing epilepsy to the general population. What causes epilepsy? The cause of epilepsy is unknown in half of cases. We know that genetics, family history play an important role. Seizures or epilepsy can also be caused by anything that causes damage to the brain, including head injury, stroke or brain hemorrhage, brain infection or inflammation, such as meningitis, encephalitis, or a brain abscess, brain malformations or tumors, brain disease such as Alzheimer's disease, chronic alcohol or drug use, genetic factors, high or low blood sugar, and other biochemical imbalances. However, seizures may not develop for years after damage to the brain occurs. How is epilepsy treated? Most people with epilepsy are able to control their seizures with anti-epileptic medicines and by avoiding triggers. The type of anti-epileptic therapy you need to depends on factors such as how old are you and what types of seizures you are having. Many anti-epileptic medication require blood tests to make sure the levels in your blood are not too low or too high or causing other medical problems. Several new treatments are being explored. This includes surgery on the area of the brain causing the seizures, vagus nerve stimulation. Nerves in the neck are stimulated by a device placed under the skin. A strict medically supervised diet using in some children with epilepsy called a ketogenic diet. Medical cannabis, which has been shown in some studies to help people control seizures. You can read more about medical cannabis and epilepsy on the Epilepsy Action Australia website. Lil Wayne has had epilepsy. So mga kapards, dito na nagtatapos sa ating pagtalakay sa nervous system, sa mga diseases nito, at saka kung paano ito mapiprevent. See you sa next video, and stay safe, God bless, and enjoy.